There are serious dangers to obesity. This is a long list of different illnesses that are associated with obesity, and the list is growing. Diabetes, that we all know, high blood pressure, sleep apnea. Sleep apnea, some of you may not know what it is, but it's actually a very dangerous condition, very closely associated with obesity. It is a dangerous condition that can lead to dying in one's sleep, because with sleep apnea people stop breathing, and the longer the intervals of time in which they don't breathe, the more the danger of them not waking up. So if your doctor told you that you have sleep apnea and you have to use a machine, please use it. Many other diseases, almost every organ system is affected by obesity, including some type of cancers being more common in the presence of obesity. Early death, clearly. If you look at a place where there are seniors gathered around, you will not see very many people with clinically severe obesity among them, because those who can live longer are the ones who don't have a weight problem usually. For people who've never had a weight problem, this looks like a simple solution. And yet many of you know that it is one of the hardest things to accomplish. I see patients come into my office time and time again, sitting down telling me their stories, telling me how they have accomplished each and every task they want to do in their life, but when it came to losing weight, they have been defeated. Not because they didn't have willpower, not because they didn't try. It's because it is very hard, very hard. The most common New Year resolution is what? Losing weight. And why do we keep on repeating it year after year? Because we don't succeed. It is very hard. What options do we have? We can look at diet, behavior modification, drug therapy, and all studies show that the weight loss accomplished with these methods is actually very marginal at best. On the other hand, if you look at the procedures or treatments we're going to concentrate on tonight, gastric bypass, adjustable gastric banding, and to a certain extent, sleeve gastrectomy, which are 3 possible surgical options, the actual weight loss, when you compare it with diet and other programs, is staggeringly high. Gastric bypass is one option. Adjustable gastric banding is another option. And sleeve gastrectomy. We will talk about these 3 options tonight. There are other options as well. We do not do them in our practice. Weight loss surgery is a serious approach. It's not like a diet where somebody recommends it to you. You say, I will go and try it. And then if you don't like it, walk away. It's not like that. It's a very serious approach. But it is a serious approach to a serious problem. Weight loss surgery is the best, the most effective, and the longer lasting treatment available. Clearly, we have to understand that in the long term, to be able to tackle this problem as a society, we have to tackle all the other issues I talked about earlier on. We have to transform the way we live. But we're here with this problem now. So what do we do? Should we suffer with the illnesses associated with obesity? Should we face the prospect of early death? Not necessarily. Who is a potential candidate for weight loss surgery? Weight about 100 pounds over one's ideal body weight, a body mass index of 40 or greater, and very, very important, there has to be a commitment to a lifetime of changes.